Good, Wyatt. Okay, let's talk about some orthopedics. On Your Side on Call is open right now. It is Sports Medicine Month, and joining us now is Dr. Timothy Talbert, who is an orthopedic surgeon at the Highland Clinic. Thank you so much for joining us. I know that a lot of people have questions because they might be facing having a joint replacement. Knees, hips, are those the most common?
Those are the most common joint replacements that are done, and certainly the ones that we do, but you can have shoulder replacements or ankle replacements, even wrist replacements, but a lot less common.
A lot of this is done with robotics now. Have you noticed a difference in the outcomes?
Well, with robotics, it's certainly a more precise surgery. It's, one of the misconceptions is that the robot's doing the surgery. That's not happening. Your surgeon is still doing the surgery, but what we have noticed is that with robotics, we're a little more precise with what we're able to do. And so in that sense, we have noticed better outcomes for the patients. In my opinion, we've seen a little quicker recovery, a little less pain, certainly more accuracy with how we place the implants.
That's right, that's right. And now patients have the option of going home on the same day?
That's correct. Probably one of the best things, or the only good thing maybe we got out of COVID, was that we got better at doing outpatient joints. People came and they didn't want to stay in the hospital because of the risk of infection or exposure, but we got better at sending them home the same day, and people like that. They like sleeping in their own bed. They're more comfortable. They have their family around. They're not being woken up several times a night for blood draws and blood checks. And we found that patient outcomes were actually better.
Really?
We found people walked better, got back to activities more quickly, and certainly were more satisfied with their surgery that way.
How has the device changed over the years, too?
So the implants have become more durable, and most of this is with the plastic. So when we do total knees and total hips, the metals are about the same, but the plastic that we use between the joints, between the metal surfaces to act like cartilage, has a better longevity, better survivorship, and the durability is better, so the implants last longer. So you can do more activities, they can handle loads or function more in a better way than they have in the past.
Yeah, somebody's trying to reach you, and everyone who I've talked to who's had some type of joint replacement always says they wish they had done it sooner.
That's right.
All right, grab that call.
Thank you.
Thank you so much, Dr. Talbot. Okay, again, the number to call is right there on your screen, 318-861-KTBS, 318-861-KTBS, and our special thanks to the Highland Clinic.
Our Side on Call lines are open for just a few more minutes. It is Sports Medicine Month, and joining me now is Dr. Timothy Talbert, an orthopedic surgeon with the Highland Clinic. And Dr. Talbert, what are the typical treatments that you see for some things like broken bones or a bad sprain?
Well, when you have a sprain or an injury, the first thing you want to do is ice and stabilize it. So at home, if you're not sure what to do, just try to put something on there that'll help stabilize it to where it doesn't move around too much, an ACE wrap, any type of brace that'll help, and then ice is the main thing. Now, if you feel like it's broken, you feel things moving in it that aren't supposed to, you need to get it checked out, Go to an urgent care, go to an ER, come to the clinic, and we'll take care of that for you.
Absolutely, and obviously you guys deal with everyone, a lot of athletes as well locally, but as some of us get older, you start to feel that joint pain here and there, things are hurting. What are the best ways to manage that pain before you consider surgery?
Well, you want to start with staying active. A lot of people think that if it hurts, you need to stop and be still. That's actually detrimental. Okay. So exercising the appropriate way, stretching exercises, anti-inflammatories, ice is still a mainstay. Doing things that are healthy exercise-wise, low impact, not heavy impact, and you can work with a trainer or see your physician and get advice on how to do that. Injections are also helpful, and then if those don't work, it's time to see the orthopedic surgeon to see what can be done for you.
And come see you guys at the Highland Clinic.
That's
you
right.
guys do awesome work. I did want to talk a little bit about sports, since that's my main job, and the athletes that you guys service at the clinic locally. You have trainers spread out to all these different high schools. How vital is it to provide that service for our athletes?
It's really important. A lot of athletes aren't sure about the severity, the safety, and when to return to play. And that all can be helped tremendously with a trainer. So the way to assess an injury, know how to push it, when to push it, what to do, that's all really important. And the trainers are very well equipped to know when to contact us for us to evaluate you in the clinic.
Well, I know from all the athletes I speak to, I hear nothing but good things about the Highland Clinic, and I think that goes for everyone. We're so thankful for you guys taking some time to be with us today.
We love taking care of our athletes.
Absolutely. Remember, the On Your Side on Call lines, you still have about 15 minutes left to get your questions in here with Dr. Talbert. Call now to get those questions answered. 861 5827. That's 861-KTBS. The lines will close at 7 o'clock. Let's get a live look outside for you. Looking at Toledo Bend, a beautiful day out on the water. Patrick joins us with another check of your